I'm Lauren Kenko.
I'm Lauren Rimmer.
And I'm Demetria Correa, and we're all pelvic health physiotherapists here at PhysioPlus.
Pelvic physiotherapy is a subspecialty of physiotherapy that involves assessment and treatment around the pelvis.
The pelvis involves different joints as well as muscles, ligaments, and nerves that all run through and attach onto the pelvis here.
Each session is patient-driven and completely based on our patient's needs. We understand that pelvic health is a sensitive topic and difficult to discuss. We want you to know that there are resources out there and people here that can help you.
Pelvic physio is different from regular physio because we're rostered with the College of Physiotherapists of Ontario to be able to perform an internal assessment. This basically means we have done courses and training beyond our regular physiotherapy masters to be able to perform internal assessments and treatment.
We are able to treat all individuals, regardless of your age and whether or not this is a new or long-standing pelvic issue. Some common conditions that we treat are pelvic pain. This pain may be with intercourse, with insertion, or any kind of pain within the pelvic region. This also includes hip, low back, or leg pain that may not have resolved with previous physiotherapy or previous treatment interventions. Another common condition we treat is incontinence. This can be bowel or bladder incontinence, and it can involve urge incontinence, which is leaking before making it to the bathroom, as well as stress incontinence, which is leaking with jumping, running, coughing, sneezing, any kind of high impact or high pressure movement. Another common condition we treat is prolapse, and this may involve an unusual sensation within the pelvic region, as well as heaviness. Some other common conditions involve endometriosis, dysmenorrhea, diastasis recti, constipation. There are numerous issues, and so if you are experiencing one of these, call the clinic and we can figure out if we're able to help.
Sessions will be in a one-to-one private setting with your physical therapist. First, you'll discuss some of the subjective history, so things that you have going on, and then we'll also take a look after that at the objective assessment, so see how you're moving and how those things feel externally. We may also want to do an internal exam, and our reasoning for this is there are some structures that cannot be palpated from external, so we may need to go internally to be more specific to some of those pelvic floor muscles. This allows us to assess and treat for pain, strength, and some tension that might be going on in your pelvic floor. Based on those assessment findings and then goals we might establish together, then we can come up with a treatment plan. Based on that treatment plan, we'll talk about education and then also possibly some exercises or other things that we can do for you at home so that you can feel better faster.
Pelvic physio doesn't just have to be an internal assessment lying down. It should also include an assessment of functional movements to look at core and pelvic floor strength and coordination. It is important to progress to these higher level exercises, especially if your goal is to return to walking, lifting, jumping, or running without symptoms.
Everyone's needs are different, and so together we'll come up with a treatment plan that is specific to your needs and goals.
That treatment plan will help to guide sessions, and people will start to notice differences even with just a small number of them.
Sometimes it can take a few sessions to notice a considerable difference, and this is mainly because it takes time to build muscle strength or to work on muscle relaxation. With this being said, we often see you less as you improve, but we still check in occasionally to make sure you're on your way to meet your goals.
So, if you or someone you know is suffering from pelvic issues, don't hesitate to give us a call. Our team can help.